2,500 years ago, a woman was walking on the streets of Babylon, just hanging at the hanging garden, where a frog turns back and says, "Madam, will you please pick me up and give me a kiss? I'm a prince, and I will turn on to this most magnificent specimen of a man." The woman picks up the frog, takes a good look at him, and puts her in her bag. The frog, astounded, turns back and says, Madam, please give me a kiss. I'll take you on a date." Nothing. "Madam, I'll date you every week." Nothing. "Madam, I'll marry you." Nothing. "I will make you my queen." Nothing. Eventually, the frog gets really annoyed and says, "Look, what is wrong with you? I've given you everything you want, and you still are not responding." And the woman turns back and picks up the frog and says, "Hey, froggy, I'm a professional healer. I have no time for your dinners and dining and your royal shenanigans, but a talking frog in my bag, that's really cool." And I love that story as an entrepreneur because it reminds me it's never about what you have to offer or you want to build. It's always about what is it that people need. And if you think about it, what is our greatest need in healthcare? What is it that we use in healthcare in 95% of all our healthcare interactions with the world? Let me tell you a true story. 2 years ago, I was in a global conference in a developing country, in the kind of place that all these successful executives get together. I don't know why I was there, but I was there. And I'm not the world's most extrovert person. So after the dinner, I went to my room to call my family, as I always do, to see how they were. And my wife told me that the night before, my smallest child got very ill, and she had to make a decision on whether we take all 3 children up to the emergency room for this one to be seen. Luckily, we have lots of good friends who are doctors. She called one. They said, "You know what? That's okay. It can wait until the morning." In the morning, she called our GP, who unfortunately didn't have any time to see us. Luckily, we could afford a private GP. Some fortune later, she still had to take the afternoon off and take my son there. And I was telling that story that night to my peers in that conference. And as very competitive executives do, you should see what happened. In my country, I don't wait a day. I wait 3 days. In my country, I wait 5. In my country, I wait 7, 10, 12. I mean, it was just going on and on. But one thing was for sure. The very basic access to healthcare for all of us was a problem. And if that was a problem for people doing well, irrespective of which country they were in, it is almost an impossibility to have access to readily available healthcare for 70% of the world population. In that very same event, I met Grace, a woman that worked at the hotel. Her family lived in the center of the country. She had a son called Bam, same age as my son, playing football, barefoot, cuts his feet, gets infected, nowhere to go, and Bam gets septicemia and dies. And yet every person I talked to had one of these in their pocket, as you do, all of you in this room. So we sat down and we started the project saying, what if we could take most of the healthcare we need in our day-to-day life and deliver it to you through your mobile phone? Far-fetched? How many years ago was it far-fetched to get your music, your friends, your banking, your books through your mobile phone? When I was growing up in the Caspian Sea at the north of Iran, as a teenager, if I wanted to buy music, I would go to the capital of the country 9 months to a year later to buy the same music that you guys would have bought at the time. We completely democratized access to music. Whether you're in Kenya or Kentucky, it's a teenager, nowadays you get your music almost exactly at the same time. What if we could do that with healthcare? So we created something called Babylon. I'm going to show it to you. We're proud of it, but it doesn't mean it's that great. We may be just a frog thinking what we're doing, it's cool. Let me see if this gets connected. Are your colleagues coming on? Fantastic. Oops, that wasn't supposed to show. Those of you who don't believe in miracle, by the way, check that out. That woman married me. I mean, how cool is that? So this is Babylon. And remember, it's supposed to do the very basic in a very easy way. So there's nothing miraculous about this. Sometimes it's supposed to do consultation and diagnostics and monitoring, the kind of things we use most of our time, as easily as possible. So what you see on the top is ask. Sometimes you don't want to talk to a doctor. You're in your pajamas. You just have a simple question to ask. So you go in and you say, I don't know, what's wrong with my toe? You can talk it. You can type it. You could add a picture to it. So here is a picture I've got before of somebody's toe. Please don't think this is my toe. Of somebody's toe. And we have doctors, nurses sitting in our places and responding to every single question individually to every single person. But most times, that's not what you want to do. Most times, you actually want to talk to a doctor. But why should that be any more difficult than calling a Hailo cab? So if you want to make an appointment, here it is. You say, I want to talk to a GP. I want to do it, say, I'm done at 4 o'clock. I want to do it on video. That's it. Less than 5 seconds, your appointment is made and confirmed. That's all you got to do. At the time of your appointment, we call you on a secure line. You decided to do this on video, and you have a face-to-face with one of our doctors. These doctors are out of every 10 GPs that we see, we employ one. Out of most of the consultants we see, we take a very small number of leading consultants in the country. But, and it doesn't matter where you are. On the beach, at your work, in your home, you get this done. As soon as the consultation is over, because our doctors are at the top of their game, none of them mind you rating them. And all of them have agreed that if you rate them less than 4, they're gone. They won't stay with us. So let's rate this one 4. And then we want your suggestions so they can improve what they do. All your notes are immediately with you, so you could see it as soon as the consultation is over. And if you need a prescription, we'll just send it straight on your note, on your phone, and you just go and pick it up. So I just say, I want to go pick it up. This is live. It says, here I am, right next door to me. Here is a pharmacy next to me. I say, Boots, quite good. So I'm going to go for it. That's it. My prescription is now at Boots. I'll go pick it up. If there is a consultation needed with a specialist, I get an alert saying that, look, you need to meet and see a specialist. I say, great. I want to still see it on the system. And I want to choose which specialist I want to have. And then, again, as easy, that's also done. Nothing more to it. And if you want to claim it on your insurance, you can. If you want to pay it for direct, you can. All your records, this whole debate on where your records should be, your records should be in your pocket. So all your records, it's here for you. It's in a secure server, same place that the Ministry of Defense and the Navy keep their stuff. We'll keep it for you there, and you can access it as much as you want. So if you want to see your previous appointments, you just go in and you watch the videos as often as you want, as long as you want. You can show it to whoever you want. All the videos or consultations are saved for you to see at any time. And if you want to see your referral notes, anything else from previous consultations were there. All your other details are there for you to see. Anything from your own personal note to your doctor's note to any x-rays or MRIs or anything you've taken in the past that you want to keep. We keep it all for you. What else have we done? We've also talked to a lot of people who told us that symptom checkers are a problem for them. They love to, sometimes don't want to talk to somebody, they want to check their own symptoms. Have you ever tried this? Every time you check a symptom checker, often you just catch, you just get cancer, or you got some other, or is it just me? Every time. So we hired some of Britain's best clinicians, put them together with some of the best mathematicians, and we rewrote the rules of a symptom checker. We wrote it right from scratch, and here it is. Let's just say I want to, I don't know, I have an earache, and let's say that, as usual, I don't know, what is it? There's a pain and a discomfort. Usually it's very mild. Usually there's no loss of hearing, and say there is no change in my appearance of my ear. That's it. That's all it does. Very quickly, it treats you like an adult and say, you know what, based on what you're saying, this is probably nothing. Keep an eye on it. hydrated, but if you want to talk to a consultant or a GP, please go ahead and do so. We also give you, I wouldn't bother you with it, but we also give you a full set of products that will allow us to turn your house into a clinic that is better equipped than most GP practices. That you can have simple, cheaper stuff that you could add, you could buy, as simple as that, and we'll send it to your home so it can be connected to your system and back to so our doctors can talk to you. Finally, and I stop with showing you that, I'm old enough, and as you can see, ugly enough, to remember cars used to break down. They just don't break down anymore. My children ask me, what's that lane on the side of the motorway that is always empty? Can we drive over it? We often do. Why is that? Partly because we built our cars so much better nowadays, but partly because we buried multiple of sensors all over our cars. So when something goes wrong, we know far ahead of it that that's happening. Our best athletes are already doing that. A friend of mine runs a football club. On Wednesday, they're checking out all of the big footballers. By Thursday, they know who they can play on Saturday or not. And it's not that difficult. Actually, all they do is they monitor the heart rate, a couple of other things, the speed at which the athlete is running, and if the athlete's heart is beating a little bit harder than normal, they kind of figure out for the same work that the heart is fighting something else. So we created what we're told is the world's most comprehensive monitoring system. And it does everything, from your fitness to your shape, but we've also divided the body into a series of clinical systems that matter to you and matter to your clinicians. So everything from your state of your mind to your heart to your kidneys, vitamins, bones, hormones, blood, we help you measure it, monitor it, keep an eye on it. So when we do the simple stuff that everybody else does, so we look at your calorie burn and what you're burning, and I don't know, here is a cycle that we've done, and so on and so forth, and if you want to add something in it, we kind of sync with 80 various devices that automatically, if you're wearing it, is going to go in there. And we also do the other stuff like your calorie count and what have you got left, and so on and so forth. But actually, and you can add it by a bar chart, you can add it by this, that, I mean, all the things that you've seen before others do. But actually, what we're really excited in, as clinicians, is not so much that. It's, for instance, in your weight, we'll help you look at your weight, but what we're really interested in is not the appearance of you looking a little bit bigger or a little bit smaller. What we want to see is that if your weight is going up, how are you sleeping? What's the state of your mind? I can see in this particular person not sleeping very well, not feeling refreshed, a bit stressed out. Then I'll go and check their heart things, and I can see that their blood pressure is going up. And I can also see that let me just check in here, that their total cholesterol is going up. So I now know I need to contact this person ahead of the time. No point in waiting for disaster to strike before I do that. So that's our ambition. Our ambition is to be, and we don't, by the way, do have that for today. We have it for, here is last year's data. We keep this data all the time, plot it, monitor it, keep it for you. So that's Babylon. That's what we're going to do. But frankly, anybody, I managed to create fire or electrical stuff here. I dropped some water. Before the whole place starts burning, could somebody help me out here? Thank God you're not trusting your life on my hand. So sorry about this. So, anybody can build things. That's easy. The question is, can you build things that everybody can afford, that everybody can benefit from? So our biggest innovation is not what we built, is the productivity and the efficiency we put in the back office that made it possible for everybody to afford it. Amazon is not great because it's got an app. It's great because it's got warehouses all over the world that work most efficiently. How much do you think you will pay for this? To have it in your pocket, a doctor, say, our starting price, a doctor in your pocket, 12 hours a day, 8 o'clock in the morning to 8 o'clock at night, 6 days a week. You can buy that for less than the cost of a cup of coffee a week. We can deliver that to you in less than £2 a week, $7.99 a month. At those prices, we're not talking about the kind of healthcare privately that can be afforded only by 10% of the population, but we think many can afford it. In a developing country, where we are already going into, we deliver that at $1 or $2 a month. That's all it costs to get yourself done. And for consultants, all GPs are included, but for consultants, we charge a little bit more, but the costs are 75% less than what you pay privately to see a consultant in policy. We charge £49, that's it. And we haven't been talking about it. One of the reasons we kept it for a long time is because we've been selling it. So I'm delighted to say that we got incredibly lucky. We will launch shortly, or we have already actually launched as of yesterday, with 30 of Bupa's, one of your sponsors, top clients. In 2 weeks' time, we will be going to every single company that is covered by Aviva. That includes everybody from Amex to Ernst & Young to Rolls-Royce to Tesco to Virgin. And then we're talking to all the other insurers. We will make those announcements shortly. But short to say that 90% of all British corporations will be using Babylon as of 2 months' time from today. But that's not where we want to stop. So we're talking to retailers at the moment. We want to take this into the high street, where people can afford to buy it on their own and pay for it at the cost of less than a cup of coffee. We will also announce in 2 weeks' time, I wouldn't leave you with the details, but I think that the government has been very generous to announce it. The government of Jersey wants to turn Jersey into the most healthcare connected population in the world. So we will be hopefully announcing that we will put the entire territory of Jersey on Babylon. So every person in Jersey can talk to their own doctor on this, hopefully. We also had yesterday in our press release the government of Rwanda, where we will be hopefully taking it to Rwanda by the end of the year, where we can take a population of 14 million people who has only 1,000 doctors, much better connected than what they are today. Now, is Babylon are we going to solve any big issues or every issues? Of course not. This is just one little solution towards many solutions we need. So I started with the story of a frog, so let me finish with the story of a starfish to make the point. This old man was walking on the beaches of Goa, and I don't know who has been to Goa. It's one of the most beautiful places on earth, and it has tens of miles of beautiful beach. And as this old man was walking, he saw this little girl picking up a starfish and throwing it back to the sea. And for those of you who've been to Goa, you know what happens is every day the tide brings millions of starfish, leave it on the coast for it to bake, and unfortunately most die. So this little girl was taking one, throwing it back into the sea, saving it. The old man went to the girl and said, "Little girl, what are you doing? It makes no difference. There are millions of them out there." She picked up another starfish, she threw it back into the sea, and she said, "It made a difference to that one." Thank you very much for listening.
Great ambitious vision, Ali. So when you're launching, how many medics are you going to have on the system?
We already have over 100 doctors on the system. But remember what we do, so we got very lucky. We launched it yesterday. It already got done very well on the charts. So we've now almost had to queue people now. So now if you download, it's on the App Store. You can download it, but we will queue you. We then bring the doctors on board to serve you, and then we'll open it up to you. So it depends on demand. The more demand we get, the more doctors we put in. But we have a huge pipeline of doctors that we can activate as time goes. But we employ all of our doctors. So it's not an exchange. It's where everybody's trained, everybody's employed by us.
So you could be seen as competition for the health insurers. Instead, you're trying to partner with them.
You know, if you grow up, David, looking like me and being my size, you don't like competition. It doesn't work. For guys like me, working with people is a lot better. So we don't see this as competition at all. We think this is helping insurers, and that's how our partners in the insurer community see it, is helping them to provide a better service at lower prices, more accessible to the people they're serving. And that's why we're seeing such a good take-up by corporations and insurers.
Best of luck. Ali Parsa.
We need it.